So today, a very unique and I think important program is being launched. More than a program, it's assistance and support for people who are having SMA. And we all know the problems that SMA causes and the disabilities and the difficulties that children face when they are diagnosed with this disease. And also the cost of care is so high, and also not only financial but also emotional trauma. The parents, the family members also go through. So, and of course it is a lifelong kind of a problem, and it requires medication which is of a very high cost. ಅದರ ಖರ್ಚು ವೆಚ್ಚ ಏನಿದೆ ಬಹಳ ಹೆಚ್ಚಿರುವಂಥದ್ದು ಮತ್ತು ಜೀವನ ಪರ್ಯಂತ ಅವರು ತಗೊಳ್ಬೇಕು. ಸೊ ಇದು ಪಾರ್ಟ್ ಆಫ್ ದ ರೇರ್ ಡಿಸೀಸಸ್, ಜೆನೆಟಿಕ್ ಡಿಸೀಸಸ್ ಅಂಡ್ ರೇರ್ ಡಿಸೀಸಸ್ ಅಂತ ಏನು ಹೇಳ್ತೀವಿ. ಸೊ ದಿಸ್ ಇಸ್ ಇನ್ಹೆರಿಟೆಡ್ ಡಿಸೀಸಸ್ ವಿಚ್ ಕಮ್ ಇನ್ ಯುವರ್ ಚೈಲ್ಡ್ಹುಡ್ when you are infancy only. So it is a big challenge for governments, because for people who cannot afford treatment, for governments with our resources, where we can we do treat people who got this kind of problem, but there is a certain limitation in our budgets, and lifelong treatments at high cost becomes a very very difficult proposition for governments to fund it. And we're always looking for donors and supporters from CSR funding and foundations and philanthropists to do that, because we have so many priorities. If it is a high cost and curable disease, then I think it becomes easier for governments to support and do the. But these are something which has really no cure as far as I know. But it can be sustained. They can be supported, and they can lead at least close to normal life if they have got the right support. And for that, I think what today CPCT is doing, I think committing support for these people, especially for the poorer families, ಯಾರು ಏನು ಖರ್ಚು ಇರ್ತದೆ ನೋಡ್ಕೊಳ್ಳೋದಕ್ಕೆ ಅದು ಅವರು ಕೊಡಕ್ಕೆ ಆಗೋದಿಲ್ಲ. ಲಕ್ಷಾಂತರ ರೂಪಾಯಿ ಆಗ್ತದೆ, ಅದು ಕೋಟ್ಯಾಂತರ ರೂಪಾಯಿ ಕೂಡ ಖರ್ಚಾಗುತ್ತದೆ ಅವರ ಎಲ್ಲ ಪೂರ್ತಿ ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳೋದಕ್ಕೆ ಅಲ್ವಾ. ಕ್ರೋರ್ಸ್ ಆಲ್ಸೋ kind of expenditure is there. So ಇವತ್ತು CPCT ಅವರು they have come forward to support along with our Indira Gandhi Institute and the Child Institute, which is a center for excellence for us, which takes care of all these rare and genetic diseases. And I want to thank them for coming forward to do this. I think many jana papa family members this is giving them hope and giving them the life of the child, and so much of physical and emotional support apart from financial support you are giving them. So it is a wonderful thing that you are doing. I think you have committed to almost treating per year. Any number has been fixed or
50 patients.
50 patients in a year. This year 50 patients they want to take care of. That is a very big commitment. Very big commitment. And runs into almost quite more than I think 10 crores. 14 crores. So the commitment for this year is 14 crores. So ಇದು ಕೆಲವೊಂದು ಸಾಧ್ಯನೇ ಇರ್ತಾರೆ ಅಲ್ವಮ್ಮ. ನೀವೇ ಇದು ಟ್ರೀಟ್ಮೆಂಟ್ ತಗೊಳ್ಳಿ ಅಂತ ಹೇಳಿದ್ರೆ ಇದಕ್ಕೆ ಸಾಧ್ಯ ಆಗ್ತದೆ. ಗೌರ್ಮೆಂಟ್ 50 ಲಕ್ಷವರೆಗೂ ಒಂದು ಲಿಮಿಟೇಷನ್ ಇದೆ, ವೇರ್ ವಿ ಕ್ಯಾನ್ ಸಪೋರ್ಟ್. ಗೌರ್ಮೆಂಟ್ ಆಫ್ ಇಂಡಿಯಾ 50 lakhs ವರೆಗೂ ಸಪೋರ್ಟ್ ಇದೆ. ಬಿಯಾಂಡ್ ದಟ್ ಆಮೇಲೆ ಅದು ರೀಚ್ ಆದ್ಮೇಲೆ ನಾವೇನು ಮಾಡೋಕ್ಕಾಗಲ್ಲ. ಅದು ಒನ್ ಟೈಮ್ ಆರ್ ಫಾರ್ ದಟ್ ಪರ್ಟಿಕ್ಯುಲರ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಸೊ ಈಗ ಈ ಥರ ಮುಂದೆ ಬಂದಿರೋದು ಇವತ್ತು ಯಾರು ಆ ಮಕ್ಕಳಿಗೆ ನಿಜವಾಗ್ಲೂ ಕೂಡ ಬಹಳ ಇದರಿಂದ ಒಂಥರ ಪುಣ್ಯದ ಒಂದು ಅವಕಾಶ ಸಿಕ್ಕಿದೆ. ಖಂಡಿತವಾಗಿಯೂ ಈ ಥರದ ಕೆಲಸಗಳು ಎಲ್ಲರೂ ಹೆಚ್ಚಾಗಿ ಮಾಡಲಿ. ಆ್ಯಂಡ್ ವಿಶ್ ದಿಸ್ ಪ್ರೋಗ್ರಾಮ್ all success and every support from our departments, health and family welfare, medical education, whatever is there, we will try to do. But my special thanks to CPCT, and I think we know better than this everybody can do, and I think this is wonderful. And I want to thank on behalf of all the people and on behalf of the Karnataka state of Karnataka. Thank you very much.
Very
very good program, especially for the patients with SMA and their parents, especially whose children are suffering from this SMA. This being a rare disease, I have to thank CPCT for this good gesture. It's a great gesture from CPCT for having come forward to support nearly 50 patients. They are supported to the tune of around 14 crores this academic year, for this year. And also, Indira Gandhi Institute of Child Health is doing an excellent job by establishing a center of excellence for rare disease. And Government of India is also supporting for the rare diseases with 50 lakh rupees per patient. So, especially the Karnataka government is trying its best, and the Honorable Chief Minister Sridhar Manaji has been very supportive, especially for health and medical education departments, for giving all the best possible healthcare, quality healthcare to the people of this state. And this being a special center of excellence where rare diseases are being taken care of. So even the government of Karnataka is contributing around 10 crores to this. And I'd like to thank once again CPCT for supporting this. And we look forward for the quality of life of the children, especially who are suffering from SMA. And we hope they will get best of the treatment and support.